You wake up in the middle of the night with a burning chest, you feel bloated after every meal, and no matter what you eat, something just doesn't feel right. You've tried antacids, you've changed your diet, but nothing seems to work. What if I told you all of this could be coming from one hidden condition that millions of people have, and most of them don't even know it? It's called a hiatal hernia. And today, I'm going to show you 7 signs your body might be trying to warn you right now. But before we dive in, if you're new here, welcome. On this channel, we break down complex health topics in a simple, easy-to-understand way, so you can make better decisions for your body. Make sure you subscribe and hit the bell so you don't miss our upcoming videos. Now, let's talk about what a hiatal hernia actually is. Because before you can recognize the signs, you need to understand what's happening inside your body. Your diaphragm is a large muscle that sits between your chest and your stomach. It has a small opening called the hiatus, and that's where your esophagus passes through to connect to your stomach. Normally, everything stays in place. But when part of your stomach pushes up through that opening and into your chest cavity, that's called a hiatal hernia. Now here's the thing. A hiatal hernia doesn't always cause obvious pain. In fact, many people walk around with one for years without ever being diagnosed. But the body always sends signals, and those signals often get mistaken for acid reflux, anxiety, heart problems, or just stress. There are 2 main types: a sliding hiatal hernia, which is the most common, where the stomach slides in and out of the chest, and a paraesophageal hernia, which is rarer but more serious, where part of the stomach gets trapped above the diaphragm. Today we're focusing on 7 of the most common and important signs that could suggest you or someone you love has a hiatal hernia. Pay close attention, because some of these might surprise you. And remember, this video is for informational purposes only. Always consult your doctor for a proper diagnosis. All right, let's get into it. Starting with sign number 1. Sign number 1, and probably the most well-known, is heartburn, also called acid reflux. Now, most people have experienced heartburn at least once in their life. That burning sensation that rises from your stomach up into your chest and throat after eating. But here's what separates normal heartburn from hiatal hernia-related heartburn: the frequency and intensity. When you have a hiatal hernia, the valve between your esophagus and stomach, called the lower esophageal sphincter, gets weakened or displaced. This allows stomach acid to flow back up into your esophagus much more easily and much more often. So if you're experiencing heartburn more than twice a week, if it wakes you up at night, or if antacids barely touch it, that's your body waving a red flag. Don't brush it off as just something you ate. It could be something more. Sign number 2 is chest pain or pressure, and this one scares a lot of people for good reason. When stomach acid repeatedly irritates the lining of your esophagus, it can create a pain that feels shockingly similar to a heart attack. A tight, heavy pressure in the middle of your chest. Sometimes it radiates to your back or jaw, and it often gets worse after eating or when you lie down. Now, and this is very important, if you ever experience sudden, severe chest pain, please seek emergency medical help immediately. Never assume it's just your hernia. But for many hiatal hernia patients, chest pain is a chronic, recurring experience that gets dismissed for years. If your doctor has already ruled out heart problems and you're still having chest discomfort, a hiatal hernia should absolutely be on the table. Sign number 3 is difficulty swallowing, medically known as dysphagia. Have you ever felt like food is getting stuck in your throat or chest after you swallow? Like it's just sitting there and won't go down? That's dysphagia. And it's one of the more uncomfortable symptoms of a hiatal hernia. Here's why it happens. When part of your stomach pushes up through the diaphragm, it can put pressure on your esophagus and narrow the passage that food travels through. As a result, swallowing becomes difficult, sometimes even painful. Some people describe it as a feeling of tightness or a lump in the throat. Others feel it more in the chest area. It can happen with solid foods, and in more severe cases, even with liquids. If you notice this happening regularly, especially combined with other symptoms on this list, it's time to talk to your doctor. Sign number 4 is regurgitation, and this is different from vomiting. Regurgitation is when partially digested food or sour liquid comes back up into your mouth without warning and without the forceful contractions of vomiting. It can happen right after eating or even hours later. Sometimes it happens when you bend over or lie down. For people with a hiatal hernia, this happens because the stomach is sitting in an abnormal position, and the barrier between the stomach and esophagus is compromised. Acid and food content can travel back up with very little effort. This symptom can be deeply uncomfortable and even embarrassing in social situations. It can also damage your teeth over time due to the acid content. If this is something you're dealing with regularly, please don't ignore it. It's your body telling you something is structurally off. Sign number 5 might surprise you. Shortness of breath. Most people don't immediately connect breathing problems with a stomach condition, but with a hiatal hernia, it makes complete sense. Remember, the stomach is pushing up through the diaphragm, which is the primary muscle your body uses to breathe. When the stomach occupies space in the chest cavity, it can press against the lungs and restrict their ability to fully expand. This leads to a feeling of breathlessness, especially after meals when the stomach is full and putting even more upward pressure. Some people describe it as feeling like they can't take a deep breath or that their chest feels tight and restricted. If you notice you get winded easily after eating or that breathing feels harder when you're lying down, a hiatal hernia could be the reason why. Sign number 6 is something a lot of people dismiss as just a normal digestive issue: frequent belching and bloating. Yes, everyone burps. And yes, everyone gets bloated from time to time. But when it's happening constantly, after almost every meal, even small ones, it's worth paying attention to. With a hiatal hernia, the abnormal positioning of the stomach affects how food and gas move through your digestive system. Gas gets trapped more easily, and the body tries to release it through excessive burping. The bloating can make your stomach feel distended and uncomfortable, sometimes even painful. What makes this symptom tricky is that people often chalk it up to food intolerance or IBS. And while those are valid conditions, if you're also experiencing other symptoms from this list, the root cause might actually be a hiatal hernia. And sign number 7, one that almost nobody connects to a hiatal hernia, is a chronic cough or hoarseness. Here's what happens. When stomach acid repeatedly flows back up into the esophagus, it doesn't always stop there. Sometimes it reaches all the way up to the throat and even the vocal cords. This is called laryngopharyngeal reflux, or silent reflux, because it often happens without the obvious burning sensation of heartburn. The acid irritates the throat and vocal cords, causing a persistent dry cough, a raspy or hoarse voice, or a constant need to clear your throat. Many people with this symptom spend months being treated for allergies or asthma, never realizing the real cause is coming from their stomach. If you have a cough that just won't go away, or your voice has become chronically hoarse without an obvious reason, this could absolutely be the missing piece of your puzzle. So there you have it. 7 signs and symptoms of a hiatal hernia that you should never ignore. From heartburn and chest pain to shortness of breath and that chronic cough that just won't go away, your body is always communicating with you. The key is knowing how to listen. Now, experiencing one of these symptoms doesn't automatically mean you have a hiatal hernia. But if you're dealing with multiple symptoms on this list on a regular basis, please don't brush it off. See your doctor, ask about an endoscopy or imaging test, and get a proper diagnosis. The good news is, hiatal hernia is manageable. With the right lifestyle changes, medication, or in some cases surgery, most people go on to live completely normal, comfortable lives. If you found this video helpful, give it a thumbs up. It really helps this channel grow. And if you know someone who's been struggling with unexplained digestive issues, share this video with them. It might be exactly what they needed to see. Don't forget to subscribe for more health videos like this one. I'll see you in the next one. Take care of yourself.